Sildenafil is a phosphodiesterase inhibitor which is used for treatment of erectile dysfunction. It is also commonly known under the brand name Viagra. Sildenafil works by increasing blood flow in the spongy erectile tissue of the penis that consequently allows it to grow in size and become erect and rigid. Now, how to use this medication? First and foremost thing is to consult your doctor before taking this medicine, because there is a rare but severe side effects and drug interactions with other medicines. To treat erectile dysfunction, take this drug by mouth as directed by your doctor. Take sildenafil at least 30 minutes but not more than 4 hours before sexual activity. Taking it 1 hour before is also most effective. But remember, do not take it more than once daily. A high-fat meal can delay the action of the medicine, so take light meal while you are planning to take this sildenafil. Now let's talk about the side effects. Taking sildenafil with nitrate medicine can suddenly and severely decrease your blood pressure. These medicines are usually taken 30 minutes to 1 hour before sexual activity. There are many side effects like chest pain, blood pressure changes, stomach ulcer, liver or kidney problems. But here are 2 things that you should be alert of if you are taking sildenafil, as they need immediate medical attention. First is if your erection is painful or lasts longer than 4 hours. In medical term, we call it priapism. It can damage the penis. It is a very painful condition where bloods get trapped in the penis and is unable to drain through penile vessels. Now what to do in that situation? You can apply ice packs on the penis and perineum. If the priapism is non-ischemic in nature, there is a chance that it will go away. But most of the time it is ischemic in nature and the pain gets worse with time. In that situation, immediately visit or consult your doctor. We will make a detailed video on that topic in future, so don't forget to subscribe to our channel. Next is if you have sudden vision loss. Seek immediate medical attention if you face this type of problem. Also, if you're a heavy drinker, then you should make a note of this point. If you like a glass of wine or any other alcoholic beverages, then there shouldn't be any problem. But drinking more than that after taking Viagra could hamper your activity. Moderate to heavy drinking can make it harder for you to get an erection. Also, Viagra can lower blood pressure. So combining it with alcohol can increase